Clear the sinuses.
Hello, hello. Welcome. Here we are, plant powered, and we're live. And I got my girl Kindle here, sprinkling the plant powdered dust all over the world, making dreams come true. And we have an amazing Kindle. Say hello.
Hi, guys. I'm excited to be here. Thanks for joining us.
Yeah, I hear like it sounds like a jet plane. Is that from me or you guys?
If it's
Oh no,
me,
that's me. That was me. My foot
you.
was hitting a cable under my desk. It's okay. But we have a guest that is beyond special. This is a guest that literally has changed my life. Okay. And her name is Mia Howell, and she is a dietitian at the Synergy Lifestyle Center in Jacksonville. And Mia, I'm just going to brag on you a little bit and just say a little bit. She studied at the University of North Florida. And she, in addition to that, or maybe as a part of that, I'm not sure, she can clarify, but she has completed a 1,200-hour dietetic internship at is it
Best year.
Bastyr University with a focus in natural medicine. How about that? And so she's all about the power of whole nutrient dense foods and teaching others how to utilize them to meet their goals. She's a foodie, which is great to have another foodie on here, and a coffee enthusiast. Ooh, so
Ooh.
that's pretty cool. So hello, Mia. Thanks for coming on our live stream with us.
Hello, thank you for having me.
Absolutely. Well, today we want to. So, Mia works at the Synergy Lifestyle Center. She is not just a dietitian anymore, she is also now the director of the program. So, I know she looks like, you know, a teenage, a teenager. She is a fierce woman. And she is, it's amazing. I mean, she's running the clinics. When I was there, she was the dietitian teaching this cohort of people. We're actually running multiple cohorts at the same time, like, and just helping us relearn how to eat food, because as you guys know from watching this, I had some cardiac issues and I needed some work. I went to cardiac rehab, and I got so lucky that I went to an Ornish clinic, which is the one in Jacksonville, the Synergy. And Mia was the dietitian. So I've learned so much from her, and we're going to get to learn from her as well. You're going to get to learn from her today as well. If you're watching us live, I see a few people on here. Hello and welcome. You can pop your comments right into the chat wherever you're watching this, because we're streaming multiple places, but we'll see your questions. And then just let us know. Yes, thanks for the heart. All right, and don't forget to like us, follow us, and all that good stuff, because we want to keep giving you good ideas about how to eat plant-based and get healthy. All right, Mia, let's let you talk. Let's talk about your journey. Can you share your journey into becoming a dietitian, and more specifically, how it ended up like with a specialization in like plant-based cardiac rehab and low-fat stuff and all that good stuff? Tell us your story.
Yeah, so when I was in high school, it feels like a long time ago now that I was struggling with some of my own health issues. And my aunt is a dietitian, and she specializes in functional medicine. And she was also a vegetarian, and my oldest sister is also a vegan. And so it's always been around in my life. And that really helped me during that time, and just being mentored by my aunt for my own personal health issues. And then once that was resolved, just continuing to learn from her inspired me to then study that in college and become a dietitian myself. And along with the functional medicine and emphasis on plant-based nutrition, along the way, wasn't always focused on plant-based eating, but still that was a tenet of what I incorporated into my lifestyle and was modeled to me. And so that led me then to going to Bastyr, that's located in Washington. There weren't many dietetic internships that focused on holistic medicine or functional medicine. So I was really drawn to that program. But most dietetic internships are 1,200 hours, and they cover very general concepts. And so that's where the specialty comes into play. So just like any other field, you can specialize. I thought I was going to go down the route of functional medicine, where we can get additional certifications. But before I went to my internship, I found Synergy. So I volunteered and worked here as a nutrition assistant. Me and my friend would come here and make desserts. So we learned plant-based, low-fat cooking, interacted with participants, really got to know the guidelines, interacting with patients, the other components and elements of the program as well. So it's a good introduction. And I had no idea the path that it would lead me on. And so when I graduated from my internship, the dietitian was transitioning out, and it was an opportunity for me to transition in and return to Synergy as a dietitian. So that's how I ended up in cardiac rehab.
Mia, I want to have you back on here. I just wrote down, I was like, ask Mia for her desserts, because that is a category. I think so many people, when they hear about whole food plant-based eating, they immediately go, oh, I just only eat carrots and hummus and never get to have desserts again. And you will have to come back on and show us some desserts to give our community inspiration and let them know that there are some really good foods out there to eat.
I would love to, because that's something that I hear often too. We're just kind of having that initial idea that by eating more plant-based foods that it won't taste good, you can't replace things properly. And we have a whole lesson here in the program on desserts and sweeteners. So ones that are within the guidelines, they're going to have not only just a neutral effect, but actually be beneficial to you with the nutrients you're getting, and you'll satisfy your sweet tooth.
That is amazing. What sweets, if you were going to give somebody right now a pro tip, what sweeteners would you recommend that are whole food plant-based?
We're kind of preferential to maple syrup here. I think it's pretty versatile. So we use maple syrup for the Ornish guidelines. We might get into this later, but we don't recommend more than 2 servings a day. So about 2 tablespoons. But we use dates a lot as a natural sweetener too.
Yum. Those are my favorites. Doug, did you ever eat any of Mia's desserts?
Well, here's the thing. This is what I mean, because I'm trying to be objective in this interview, because I don't get to ask Mia as many personal things, because my relationship with her is as a patient, you know what I mean? So I know what she does at the clinic, and yes, I have had the desserts there, but at the clinic, they kind of have a policy, and it was pretty exclusive before, that every recipe is completely 100% following one of the Ornish recipes that are published. And there are things you can do to still stay Ornish compliant, but not necessarily do an Ornish made recipe that I think are a little even tastier. And I would imagine that Mia has some good hacks as well for that kind of stuff. So, but with that said, yes, I have had some very good desserts at the Ornish Clinic, and so we have a tower garden over there now, Kindle. And so I go in and I visit the tower garden and take care of it. And I do just so happen to time my visits so that maybe I can have a little snack while I'm there. So I had some stuff last week with silken tofu. I think it was like a creamy, was that a salad dressing or something? It was really good last week.
Oh yeah, the vegan mayo.
Oh yeah, the vegan mayo. Do you remember what that was off the top of your head at all?
I know that yes, it was silken tofu, lemon juice, garlic powder, onion powder, just very simple ingredients. I'm sure you all, if you have silken tofu, you likely have the other ingredients as well. That one is from Empower, which is the Ornish Kitchen. And I want to add, though, it may have been more exclusive at the time you're going through the program. And the meals that we serve, we do make sure that we're serving only from the Ornish Kitchen. So it's like at this portal that our participants have access to, and they're all plant-based and no oil added.
Mm-hmm.
What we do like to teach the participants, or that's what we call our patients going through the program, at some point, once they get a lay of the land and they understand the nutrition guidelines, that they can use recipes that have been passed down in their family. They can utilize cookbooks and food blogs we teach them how to modify, like which ingredients to omit and what to add instead. So that's a really big technique and skill. I think that's really useful and important for them to have before they graduate from the program. Makes it more sustainable at the end of the day.
Yeah.
I'm curious, can you tell us more? So I've heard about dietitians before, and we have probably so many different titles and names out there. There's health coaches, dietitians, and nutritionists. Can you explain what a dietitian exactly is?
Yes, and that's a really common question. So dietitian, registered dietitian nutritionist is protected, especially in Florida. Different states have different laws, but especially in the state of Florida, you get a license and you have to go through a 1,200-hour internship. And so they have pretty strict guidelines. And then now in 2024, they're requiring a master's degree in order to be on the route for dietitian. And in order to practice medical nutrition therapy, so any nutrition counseling provided, in response to a disease state, medically required, you have to be a registered dietitian. Nutritionist, it's a pretty loose term, so anyone can really call themselves a nutritionist. So they could be really passionate and involved in nutrition and self-taught. And say that they're a nutritionist, and they might know a lot, but legally would not be able to practice nutrition counseling.
That's great to know. Okay, really very clear. So tell us more about the program, because I know Doug has shared some about this, but I know there's people who are watching and they're probably wondering, okay, she said, you graduate, like, is it school? How long does this last? Who's qualified?
Good questions. And so it does kind of feel like school. We do kind of have a running joke that, it's, you get a snack while you're here, you get a textbook, you get a, workbook, and there's nap time and stress management.
It's awesome.
Yeah. That's great. So it's a 9-week lifestyle medicine program. So this was created by Dr. Dean Ornish. So he's done a lot of research, since the 70s on reversing heart disease. So that's the main goal here is if you have existing heart disease is reversing that. So a lot of the patients, or we call them participants who qualify, have had a heart event, or they've had a stent, they've had some procedure done. So if you're looking for prevention, this could be helpful, but our main goal is to reverse. And so nutrition is one component of it. It's whole foods, plant-based, and low fat. And we encourage not cooking with any added oils. And so every time that you're here, you get a nutrition lecture and you get served a meal. So it's going to be within our guidelines. So you can try new foods, you can try new recipes, and ask any questions you'd like while you're here with a registered dietitian. Then there's other elements. So the other 3 elements, exercise, of course, like at any other cardiac rehab, there's traditional cardiac rehab that incorporates cardiovascular exercise. That element is led by our exercise physiologists. And so they will create an exercise prescription based on your physical capabilities and any other goals that you might have to progress throughout the 9 weeks. And then there's little education, slipped in each day. So on using resistance bands or interval training. So you get a little bit more each time you're here. And then the other 2 elements that really brings it all together that most Americans aren't really thinking about is stress management and group support, also known as love and support. So if you've ever read Dr. Ornish's book, Undo It, each of those 4 elements are detailed in his book and what the program is based on. So stress management, we recommend an hour each day, which our participants actually get to engage in while they're here too. They do get a full hour, and that's led by Sandra. She's a certified yoga instructor. So a lot of the techniques are based off the tenets of yoga, but we definitely do not call it yoga, or we're not practicing yoga while you're here. But there's techniques like using imagery, gentle stretching, meditation, breathing techniques to help participants, center their body, calm their nervous system. There's a lot more education too on the connection to heart disease for increased levels of stress. And then the fourth hour is group support. So our licensed mental health counselor, she facilitates that group. It's not really led. She really is involved with engaging with the participants. So really encouraging participants to identify emotions, listen with empathy. So it's a lot on building relationships, in the current ones that you have. What do you I'll pause there?
I can tell you, it all comes together in such a way. I would just say it's like magical. I mean, it's amazing. And even the way it flows when you're there, because you come in and you start off in the exercise room and so get this visual. So everybody there has gone through some kind of a cardiac event, pretty much, So, I mean, I would consider it an element of danger as well. You're getting these people on treadmills and stuff. Let's put it this way, because you know me, Kendall. I was kind of by far the healthiest person there in my group, and one of the younger people. So they put like a measuring thing on you, like with like a battery pack and stuff. So, and you have like a screen. It's kind of like Orange Theory, where there's a screen with a doctor literally looking at the screen. They're taking your blood pressure multiple times while you're working out. It's amazing. And then, but then there's snack time after that, and you get a little snack, and you go into the relaxation room, where you go through this guided meditation or stretching and all this good stuff. Then you go to therapy, and then my cohort ended in going to the classroom, where I was most excited about the food lab and like learning about reading labels. And it's just incredible, really incredible. But I'm curious, Mia, how do you apply all the stuff you've learned as a dietitian? Like, how do you apply it personally in your own life?
That's a great question, and one that participants are always asking the staff here too. And so I would say it's, I was thinking about this before we did the podcast, and it's so interesting. I was looking back on the last few years when I first was exposed to Synergy, and all the lessons I sat in on for the group support, hearing the licensed mental health counselor talk about empathy and so on. And obviously the nutrition is an ever-present component in my life. As a dietitian, I am thinking about the nutritional quality and adequacy of my patients, but also myself, and incorporating all these plant-based foods, but also the group support element. So learning what empathy is, and at what point am I incorporating that into my life? How are my relationships with people? Stress management. Am I getting an hour each day? And sometimes no, I think we're all human. And so it is a nice reminder that I'm exposed to every single day. But I think the message I would like to send is that it's an ongoing process, no matter who you are or, what level of education you have. And so I do try to incorporate my stress management, talking with Sandra, and, doing my 15 minutes of yoga or deep breathing, exercise, try to incorporate that as well. Very intentional about that. And then the relationships. Now, with the nutrition component, I am a believer that at different stages of life, for various medical reasons, the Ornish diet might not be for everyone. I will say that I incorporate it 90%. We don't include avocado or coconut for the saturated fat or high amount of fat. Our fat gram amount, I would like to clarify, is about 25 to 30 grams of total fat for reversal. So a lot of participants will adhere to that. We encourage it. But if their significant other or daughters or sons, anyone in the shared household, they tend to be a little bit more lenient, which is something that I would recommend if they don't have a medical need to be super low fat, as we're recommending. We do recognize that this is intensive cardiac rehab. And so the lower that you can decrease your fat content, the more likely that you're going to be, meeting your caloric needs. You're not going to be exceeding them, which can lead to weight gain and other chronic diseases. It can also reduce your risk of type 2 diabetes. So by decreasing the overall fat intake, cooking with less oils, eating more fibrous foods, you're already in good shape. So that's the approach that I take for myself, and is not one of reversing heart disease, but one of prevention. So I really incorporate where I can all the recipes we make here. I enjoy at home myself. I try to also incorporate it with my family, but I also can relate to that it can be a little challenging. But anywhere I can where I'm noticing, whatever element's the hardest for me, I try to be more intentional with that.
What I love that you're talking about, and that I hope people who are listening are picking up on, is I love the fact that you said this is an ongoing process. And when it comes to eating, that's very much, if only everyone could take this approach of prevention first and then not having to be on the back end doing all the reversal. But I am really impressed. I wrote down and circled it because I wanted to come back to this. You cite reversal for heart disease. And I don't know if a lot of people actually even realize that's a possibility. So many people believe that it's just the way it is. You have to get on a medication and that's for life. Do you guys have a percentage of people, how many people walk out of your clinic with no longer having the certain conditions of heart disease?
That's a really good question, and I don't have a super direct answer or percentage. Everyone is a little bit different. And so the data that we do collect, I will start with that. So Doug mentioned during exercise, wearing the heart monitor and getting vitals. So we get 3 sets of vitals. When you check in, we check your blood pressure, your oxygen, and your heart rate. We also get a weight. And you're going to be here 2 days a week for 4 hours each day. I didn't mention that earlier. So for those 2 days a week, we're getting essentially 6 sets of vitals. We're keeping track of your blood pressure, your heart rate, your weight. And so throughout the 9 weeks, we're collecting all of this, and we're also going to be checking in for any symptoms. So not only are the numbers important, but we're also checking in on any changes of your energy levels, any changes in the amount of chest pain that you're having. So we also like to get, the symptomatic version, and also any numbers that we can get. And so throughout the program, we'll keep track of that. At the end, we kind of look at everything full circle, and we'll send that to doctors. But a lot of the times, participants are reporting less chest pain. They're reporting increased energy levels. Maybe they met their goal. We've had some participants run a 5K, close to the end of their graduation. That's one of their goals. And so it kind of depends on where they're starting from. Everyone is a little bit different, and where they're going to end up. And so it's always nice when we have our wellness program too, or we have alumni like Doug who stop in and we can ask them when we check in. And so sometimes it's not documented, but they'll, report back. And one of our alumni recently came in and brought his updated blood pressure readings and how he was off medication. And so that's often what we see after the 9 weeks. But once you continue on with it, we're just trying to teach you the skills to get started. And so that way it's intended to be for the rest of your life. And so we don't put a lot of pressure on our participants to see, a lot of big changes at first if they're not ready for it. And then they'll come back to us in 6 months, at their own pace. And then you end up seeing that.
That's so beautiful. I love that you wrote teach people skills.
Yeah, and I think some of the data might on Ornish. I'm going to put a couple of websites up that I want people to know about. First one is Ornish.com. That's just Dean Ornish's general website, and I think they do have. I mean, Ornish has been doing studies since the 70s, so I think they do have data on what the reversal rates are and things like that. Being a rehab center, I don't know that you guys would be able to track people as much. You know what I mean? Because it's kind of like when you're done, you're done. I mean, I hang around because I'm I'm a fan. But where Mia actually works is called SynergyLifeCenter.com, Synergy Lifestyle. You can check out those websites. And even if you don't live in the Jacksonville area, to be able to be a patient at Synergy, I know Ornish does do some online cohorts, and there are approximately 2 Ornish cardiac rehabs in each state. I know in Florida there's 2. I don't know. One's in St. Pete, I think, or in
Sarasota.
Sarasota, over there, and then one in Jacksonville. But I'll tell you what, I mean, everybody that sees this, and I know hundreds of people are going to see this, you're going to know somebody that ends up having a cardiac event. After they have their procedure done, we pray that they survive this event. They're probably going to be offered cardiac rehab. If there's a way to get to an Ornish clinic, I would recommend it because it focuses on reversal. It doesn't focus on just medicating you and doing more bypasses and stuff. I actually talked to one of the doctors that created this one time, and he said they started this clinic because they were tired of seeing people coming back. You get your stents in one year, the next year you come back for your first bypass. A couple years later, you get another bypass, and it just got frustrating for them. So they wanted to focus more on reversal. All right, well, let's land the plane here. Kendall, do you have any final questions?
I would just love to know, like, what is one thing that you say over and over again to your patients that you think people need to hear that are watching this video right now?
Kind of like what I was saying earlier, progress over perfection. Any meaningful change, whether it's nutrition or, managing your stress, it might take some time. So to have some compassion, have some patience, reach out for help, whether it's us or anyone near you, reach out to a healthcare provider to support you in those changes. But progress over perfection. Any small changes you can make add up at the end of the day.
That is so beautiful. Thank you so much, Mia, for sharing your time. I know you have so much that you're doing on your plate, so this means a lot. And I know everyone who's watching this, thank you for being here. Thank you for joining, and just thank you for sharing your gift with what you do. Thank you.
Thank
you. It is amazing.
It was great.
Yes. All right, everybody. You have a great week. Keep it healthy. We'll see you later.